All right. Well, thank you again, everyone, for being here. So today we're going to be talking about something that I really love, and I hope that by the end of this conversation, you're going to have some love for it too. We're going to be talking about fat, and this is something that I love because I think in many ways fat has it's like a bad reputation, but I think fats are just misunderstood, and I hope that we'll be able to have a better understanding about those tonight. So as Will just mentioned, I am a veterinary anesthesiologist, and as an anesthesiologist, I deal a lot with pain in my patients, and we are always trying to find solutions to care for them in that sense, right? To provide pain relief for this patient. A lot of my patients, they come in for surgery, and so that's a painful procedure. A lot of them come in with pain already, right? They have fractures, they have lots of different reasons to be painful. And on my therapeutic arsenal and the things that I can do to treat pain, I only have three different things. Basically, I have opioids, which have been around for thousands of years, and that come from plants, from the poppy plant, right? And there's many different kinds of opioids. There is the ones that come directly from the plant, they're natural, and there is also synthetic opioids that we use for pain control. Then there is local anesthetics like, xylocaine, the stuff that your dentist will give to you when you go to the dentist and you need to have a procedure, give a shot of, xylocaine for that. And those also come from plants. The coca plant is where, this was first discovered. Obviously, today they are synthesized synthetically, but they came from plants. And then another class of drugs that we have to control pain as well are what we call the COX inhibitors. And those are your, Tylenol, ibuprofen, all of those drugs, they inhibit this specific enzyme called COX, cyclooxygenase. And so those also came from plants. And so there is, the pussy willow, for example, is a plant that has one of the ingredients that can inhibit this enzyme. And so way back in the dark ages, and perhaps even today, I suppose, people would use the bark of this plant to, extract this particular anti-inflammatory, right? And so bottom line here is that, in my practice, to care for pain in my patients, I only have really three different drug classes, and they all come from plants, which is an amazing thing. And I think we should be thankful for that, we have this amazing, nature that we can, use for our benefit. So that says, just to kind of set the stage, we're going to be talking about fats, obviously, and also butterflies. So I just want to kind of introduce that to you. And so the goals for this lecture is really to overview a little bit of the fatty acid metabolism. And so fats, we call them fatty acids, for those of you that are not, familiar with that kind of terminology. We also call them lipids. And so we're going to be talking about how we can modulate lipid signaling, basically like how these fats are playing, what kind of role they're playing inside the cells. And we're talking about those specifically to the joint, right? So we'll talk about today is going to be kind of like focused on the joint, and particularly inflammatory joint diseases like osteoarthritis, for example, or arthritis, right? And so in that particular disease, we're going to be talking about like pain. We're going to be talking the inflammation that happens there. We're going to be talking about some of the joint components like the cartilage matrix. And so the joint is composed by a cartilage, right? And that cartilage is formed by a single cell type called chondrocyte. And these chondrocytes, normally they're there happy, living their lives, and they spend, the entire life in the joints. And so they're resident cells, they're in the cartilage. But depending on the conditions, they can die, basically. And we're going to be talking about one way that chondrocytes can basically die, can end their lives, which is called apoptosis. And so there's different ways for cells to die, and we're going to be talking about this particular way. I'll tell you a little bit more later, called apoptosis. So that's the plan for today. On top here on my slide, I have this kind of like banner with the different topics that we're going to be talking about. And so you can follow through the lecture as I'm talking, and you know where we are, right? So we're going to be starting with fatty acid metabolism, then pain, inflammation, cartilage matrix, apoptosis, and then we're going to conclude. So not a lot of stuff, but it's going to be quite dense. So get ready, and we're going to, dive right in. I should say before we actually dive right in that, I don't have any financial interests or otherwise. My only goal here is, in this case, share with you what we know and how we can potentially help our pets. That's the only idea. We've done quite a bit of research in this area, and that has been with funding from different places, Grayson Jockey Club. I used to work at UC Davis in California, and they helped me out there too with some of the funds for this research, all the way down to an anonymous donor, as well as horse and cat owners. I'm extremely grateful for their willingness to allow us to conduct, enroll their pets in our clinical trials. I think we've learned a lot, and with that, we can help so many other pets by doing that. So I'm eternally grateful for that. So diving right in, so fatty acid metabolism. So we have basically two major kinds of fats. Okay, we have what's called saturated fats and unsaturated fats. And so these saturated fats our bodies can produce them. And so, like, for example, if you ingest sugar or proteins, if you had too much sugar, that sugar is transformed in our bodies into fats, and that's usually stored away, right? And so during the winter, for us in Minnesota, right, for us that don't exercise as much during the winter, we're going to store a lot of that fat that then hopefully we'll burn those during the spring, which is something that I do. I'm originally from Brazil, and so I love the winters in Minnesota, but from the inside, right, just looking out, I don't necessarily know how to ski and enjoy the winter otherwise. So I, tend to accumulate a little bit of fats for, to use up during the spring. And so those are your saturated fats. They can be produced by the body from sugars and proteins, and then we use them for energy. So we use that as an energy source. And then we have the other kind of fats that's called unsaturated. And for those, we have two subtypes. We have what's called monounsaturated, and we have what's called polyunsaturated. The monounsaturated, we can also make them. And we also make them from sugar and proteins, and they are used for energy. And so that's how they're fuel, right? They're fuel for our bodies. But then there is the polyunsaturated fatty acids, and those are a little bit more tricky. We can't really make them. So there is what's called the essential fatty acids, and those we have to ingest them. We cannot make them from sugar or proteins or anything else. We need to take them from the diet. And from these polyunsaturated fatty acids, there is two different subtypes. There is what we call omega-3 fatty acids, and I'm fairly confident that all of you has heard about these guys. Those are the fish oil type things, right? And so those are some of the omega-3 fatty acids. And then we also have omega-6 fatty acids that comes from other sources, red meat, especially from animals that are confined and, raised for that purpose. Depending on their diet, they may have a little bit more omega-6 fatty acids. And so this omega-3s and omega-6, we need to ingest from the diet, especially the essential ones, which is this alpha linoleic acid and this linolenic acid, the other one here. From there, if we take these two that are called essential, our bodies have some limited ability to produce some of the other ones. So, like, for example, we can take the alpha linoleic acid and transform into this EPA, is another omega-3 fatty acid, and then our bodies can take that and transform into DHA, which is another fatty acid. So we have a little bit of an ability to do that. Same applies for the omega-6. But even though we have this limited ability, it's not really enough to fulfill all that our bodies need. And so bottom line is that for the polyunsaturated fatty acids, we need to take them primarily from the diet, okay? So diet's really important for us to get those, right? And those fatty acids, we ingest them in our bodies, and they get stored away. They are part of the cell structure many times. And then they can be acted upon by different enzymes. And these enzymes will break them down and produce, their products, right? And so they break down these fatty acids into products, and those products they are not used for energy this time. They are actually used for signaling. Basically, they tell the cells and the tissues what to do. Okay, so they are there to kind of direct the cells, right? Do you need to undergo cell death, for example? They can do that. Do you need to have repair? They can do that. Do you need to kind of like promote inflammation? They can do that. You need to promote pain. They can do that too. So in a sense, these polyunsaturated fatty acids, the omega-3 and omega-6, they are used for cell signaling to tell the cells what to do. And that's really important, okay? So I think this is something to learn about the fatty acids, right? So we're going to be talking primarily today about these polyunsaturated fatty acids, the omega-3s and omega-6. They're used for cell signaling. We are not going to be talking about the ones that are used for energy, okay? Which is a lot of times the ones that we're more concerned about, right? We gain weight, and we're like, oh, how can we get rid of this fat? So we're not going to be talking about those today. So just starting off with the reviewing a little bit here why we're talking about this. So these omega-6 fatty acids, as I told you, they can be metabolized by different enzymes. And without going into detail about all the metabolites that they can have, the bottom line is that there is some of those, a big group of those metabolites, they're involved in pain, they are involved in inflammation, they're also involved in tissue homeostasis, basically maintaining the balance of health in the tissue. And also they have, depending on the type of enzyme that's working there, they can also result in substrate, in signaling molecules that will be analgesic and anti-inflammatory, so reduce inflammation and also helps the cell survive, right? So anti-apoptotic means like anti-death. It helps the cell survive. The issue with that is that some of these sort of good metabolites here, they can be broken down into some things that are actually not good. And that's, this metabolites, they can actually end up, these end products, they can end up actually stimulating the cells to die as well as cause pain. And so, by understanding all this biochemistry, we're able to hopefully modulate some of it. And I want to take a moment here to introduce you to a very, something that I found amazing. So here we have this enzyme that you see here, SEH. S stands for soluble, EH is epoxide, and E is epoxide, and H is hydrolase. So soluble epoxide hydrolase. So this is an enzyme that's inside the cell, and it breaks down this fatty acid metabolites that are normally good into these metabolites that are not so good, okay? So the nice story about this SEH is that it was actually discovered in insects in the late 70s and in early 80s, okay, by Professor Hammock, Bruce Hammock, at the University of California. And so that is the link that we have with insects. And so at the time, what they were doing, they were trying to figure out what is some key chemicals or molecules or substances that are involved in metamorphosis, right? So the process by which a caterpillar can become a butterfly, or in this case here, a moth, right? And I wonder how many of you in the audience knows what kind of moth this is and what kind of caterpillar. So you might need to do some Googling or something like that, or for that. But this is just the most beautiful moth that I've ever seen. And this one, I took a picture of this one down in Apple Valley, Minnesota. So I was super happy about that. And then the caterpillar I found in a black walnut on my backyard. So super happy about that. So the SEH, the soluble epoxide hydrolase, it turned out that there is an enzyme in the insect that's essentially very similar, that is critical for transforming the caterpillar into a butterfly or a moth, okay? So critical for metamorphosis. And so that was where it was essentially discovered. And then obviously in the insects is a little bit different, the enzyme, the chemical structure, but essentially does the same thing. It breaks these fatty acids into these metabolites, and that allows for the metamorphosis to happen. And so this is the link between our talk today with butterflies and insects. I wish I had more time to actually tell you the whole story about this, because it's really cool, but we don't have time. So I'll leave it at there. And for those of you that don't know, this is a Cecropia moth, which is one of the largest moths that we have in North America, and this is the caterpillar for that. So a beautiful animal, also beautiful, amazing biology, these moths. Amazing, amazing biology. I encourage you to look it up. Then the other fatty acids that we have is the omega-6 fatty acids. And again, these omega-6 fatty acids, a big source of these things is red meat, especially some, not all red meats, but some red meats will have more omega-6 than others, okay? And the bottom line is that, again, these fatty acids are metabolized by different enzymes that results in substrate or products that are inducing pain, inducing inflammation, and also responsible for that tissue balance. And the same thing for, they can have metabolites that are involved in reducing pain, reducing inflammation, and helping with cell survival. And again, that soluble epoxide hydrolase enzyme is here, and it does the same thing, breaking down some of those products. We have lots of medications that we use to inhibit some of these enzymes. So we have the COX inhibitors, for example, in our pets. We use, things like Rimadyl, for example, meloxicam. There's a lot of different ones. It's one of the largest money makers for the drug industry, right? These inhibitors of this enzyme, right? And there is some newer ones as well that instead of blocking the enzyme right here, it actually blocks the receptor in the cell at which some of those metabolites would work. And so this is like a newer drug. Perhaps some of your pets might be being medicated with that, as well as being approved for using dogs with osteoarthritis. And then for the omega-3 fatty acids here, just looking a little bit more closely, again, a good source of omega-3 fatty acids like fish oils, right? But there is others as well. And most of the interesting thing about the signaling of the omega-3 fatty acids is that most of the metabolites that are produced by the enzymes, majority of them, most of them are going to be good for the body. Okay, it's going to be analgesic and it's going to help with tissue repair, as opposed to, let me go back one slide, as opposed to the omega-6. Omega-6 are like a mixed bag. A lot of them are not good. Some of them are good. And so, whereas like the omega-3s, the majority of them are actually good. But also there is, that soluble epoxide hydrolase is also here, and it will break down some of these good metabolites into, molecules that we still don't know what they do. There is still, research to be done there. So, so what have we talked about is that, again, this metabolites from the polyunsaturated fatty acids, they are good for pain relief, right? And what was found in research is that the omega-3 fatty acids themselves don't do anything. They are taken up by the body, they go and are put there in the cells, and in a sense, they are important for the cell structure, but they don't have any signaling molecule. They don't tell the cell what to do. It's only when they are broken down into those metabolites that those things then will be important for things like pain relief, right? And that depends on this enzyme that I have it in here called CYP450. There's about 40 or 50 or maybe even more of these types of enzymes. And each one of us will have a different kind of complement of enzyme because it depends on our genetic makeup. And so the amount of this enzyme and the type is going to depend. And so the amount of the good fatty acid that each one of us will be able to produce, as well as our pets, is going to vary, right? And then we already talked about the fact that the diet is really important for the amount of unsaturated fatty acids that we get. So depending on those two things, you end up with, more or less pain relief from those metabolites. And we already talked about the fact that these SCH enzymes break them down into what we call diols, which is like those end products that are not very helpful for the cell. Okay. And so I just want to share with you a little bit of the research that's being done here that shows that these metabolites from these polyunsaturated fatty acids can be very helpful. So, for example, people have figured out a way to increase their production in the body. And what they found here, and they used mice for this, and what they found is that when you upregulate, you increase the production of these good fatty acids, what happens is that you can increase vascularization. And so the blood vessels can increase their expression in an area where there is a wound, which is important, right? Because these blood vessels is bringing nutrients for that wound area, and it's going to help the tissues heal, right? So that's a good thing. So increased vascularization. Also, they have tested this in mice, and so they made like skin wounds in the mice, and they upregulated this good fatty acids as well. And what they found is that the wound healing process in the mice that had more of these fatty acids was faster, much faster healing for the tissue, which is a great thing, right? And so they show in these examples here that these fatty acids can be very good for tissue repair, both because they increase the vascularization as well as they increase the healing of that wound. So very good for that. And I have a friend in California that during the fires there, she was working with animals that were brought in with burns, and she was using fish skin both as a wound dressing as well as to help the wound repair, right? So it's a way to kind of like kill two birds with one stone, right? You put the fish skin in there and it helps with the wound repair as well as you are providing some fatty acids for that area that will help with that vascularization and healing of the tissue as well. Okay, so this fatty acid is very important for healing. Now, one thing to keep in mind is that increased vascularization can be good when you're trying to heal the tissue, but if you have cancer, that can be a little bit of a problem. So it's a concern, right? And so people have studied these things, and what they found is that if you're in these studies were done in mice, right? If the mice is ingesting a diet that's very high in the omega-6 fatty acids, that can actually increase the rate of metastasis for the tumors and increasing tumor escape from treatment, right? So basically it has a pro-tumor survival type of effect that's we don't want, right? So the tumor can get bigger and can get metastasis with that. But they also found that if, on the other hand, if you have a diet for the mice that has more omega-3 fatty acids, okay, the ones that produce more of those beneficial metabolites, then you can actually have a tumor suppression effect. And so this kind of tells us that by modulating this balance between omega-6 and omega-3, you can actually modulate tumor growth, right? If you have too much omega-6, you're going to favor the tumor. If you have more omega-3s, you're going to suppress that tumor. And so this is an important thing to remember. At least that's the evidence in mice, right? I'm not aware of any evidence similar to this one in people or pets. And so I can't say for that, but at least in mice is very clear. And so really important here is that, the fatty acids that we produce, we got to think about this balance between omega-3 and omega-6 fatty acids. Remember that we acquire those from the diet. And so choosing our diet and the diet for our pets carefully is going to affect this. Those fatty acids are going to be act upon different enzymes. And again, that's going to depend in great part by the genetic makeup that each one of us have. But remember that the omega-3s that are metabolized by this P450, they are involved in good stuff for the body, like analgesia, healing, and repair. And then the other ones, the COX enzymes, they are more involved in pain and inflammation. They have some beneficial effects as well, but again, more of a mixed bag, right? And so we definitely want to, if you were to choose, you want to tilt your balance a little bit more towards the omega-3 fatty acids, because that has, generally speaking, a little bit better effect on helping the body, right? But again, there is this enzyme called SEH that, again, depends on our genetic makeup. All of us express it in different amounts that can offset or decrease the good effects that you would see with the omega-3 fatty acids. Okay, so diet's really important. Genetic makeup also somewhat important in there too. So moving on to pain a little bit and focusing on the joints, one of the classical marks of arthritis is that there is pain associated with it, right? And that pain is very complex. There is different kinds of pain. Pain have different makeups as well. And so we see that. And of course, during arthritis, basically the joint is kind of like progressively getting destroyed, unfortunately. And so the cells, the cartilage cells are dying over time. And there is a substitution of the cells with other different tissues. And so there is what we call remodeling. So it's a huge problem. It's a very complex disease. And so knowing what we know about fatty acids, right, the omega-3s, the omega-6, and those enzymes, we have asked in our research, like, can we modulate these two enzymes to try to help the joint in decreasing the pain as well as helping the health with that joint? So in other words, can a dual inhibition of these COX enzymes and the SCH enzyme produce superior control of joint pain than blocking each one of those separately, right? So we've done those studies. And the idea here, again, just to remind ourselves, is that if I block this COX enzyme, I'm going to decrease the production of some of these metabolites that are kind of not very good. And by blocking the SCH over here, I'm going to prevent the degradation of these other metabolites that are good. And so the idea here, again, blocking production of unhelpful metabolites and then preventing degradation of helpful metabolites. That's for the omega-6 fatty acids. And if you look at the omega-3s, here we have, if you block the COX enzyme, some of the COX products are important here. So for example, the COX enzyme metabolizes these parent fatty acids into these things called resolvins. And these resolvins, generally speaking, they're involved in resolution of tissue breakdown, for example. So they're helpful for the body. And so if I'm blocking those, I'm also blocking some things that are helpful by using this COX inhibitor. But if I use the SCH inhibitor, then I'm preventing the degradation of all this other good stuff here that are important for analgesia, for pain control, as well as helpful for tissue repair. And so we have this question, right? Can a dual inhibition of this COX and SCH enzyme be better for pain control compared to each enzyme alone? And so to do that, we did a study in horses where we induced a very transient joint inflammation, and then we measure how much lameness the horses were having. And so here, this was lameness when we were blocking just the COX enzyme. When we blocked only SCH, the horses were more lame, actually, and so it did not help very much. But when we blocked both enzymes with different doses, now we were able to reduce the lameness, meaning that the horses were much better, right, when we blocked both enzymes. So it made a lot of sense to our question, right, that blocking both enzymes actually is much more helpful than blocking each enzyme separately. And we also saw the same thing with another measure of lameness in the horses here, with actually measuring the amount of force that they were putting on that leg. We also looked at later on, like the next 2 days, and we also saw that if we block both enzymes, we saw less lameness 2 days later, which is good. And also we saw kind of more or less the same thing with the peak, the force that they were putting on that leg that was more. And so this basically told us that, yes, if you block both of those pathways, that's when you get the better effect from modulating fatty acids. We're interested in inflammation as well. So now we're talking about inflammation. And we did see that some of the inflammatory markers that we looked were decreased when we blocked both enzymes, but not some of them. And so like these cytokines, and so cytokines are chemicals that are usually pro-inflammatory. They are produced by different cells. Inflammatory cells produce those. And so those like pro-inflammatory, they also kind of induce pain. So they're kind of nasty to have inside the joint. They were not decreased by the blocking the two enzymes. And so we're kind of like, wow, it is interesting. These things that are kind of nasty to the joint were not affected. And so we're curious, like, but we still saw very good pain control, and the animals were putting much better weight on the joint. We wonder why that was. And so what we did is we went to the lab, and we have in mice, we inject a little bit of those cytokines into their paw, and then we measured how painful they were and how they responded to inhibiting both enzymes. And what we found is that when we inhibited both of those enzymes, they actually had pain relief. And so we showed that even though inhibiting both enzymes were not modulating or not decreasing those chemicals, inhibiting the enzymes were blocking the action of those chemicals and causing pain. And so that was very, very good to see. So it's really helping the joint in that sense. The other thing that we saw is that during inflammation of the joint, what we see is a degradation of the cartilage matrix, right? So collagen, which is a protein, is involved in keeping that cartilage together. And when there is inflammation, that kind of like starts breaking down, right? And so we were like, well, if we inhibit these enzymes and prevent the degradation of good fatty acids and prevent formation of bad fatty acids, can we help with that structure? And what we saw is that it does help with the structure as well. It basically decreases this collagen degradation. So it actually stimulates collagen synthesis more than degradation. And so, again, is helpful for the structure of that joint. So these are all, studies that we did in these horses. And then we were curious, like, is it really helping the cells themselves? And so we did a study in vitro. So we purchased equine articular chondrocytes, and so these are chondrocytes derived from horses. And then in the lab, we plated them and we cultured them, and then we tried to mimic what happens in the joint, but now in a petri dish, right? And so we added some of those chemicals, so some of those cytokines like TNF alpha. This is a tumor necrosis factor alpha. Is a pro-inflammatory cytokine, pretty nasty, causes pain as well. So we put some of that with the chondrocytes. We also induced cell death in the chondrocytes via some other mechanisms here, which are relevant for arthritis. And so in the lab, we're trying to mimic what's happening in the joint, right? Trying to kind of stress these chondrocytes, trying to lead them to cell death, and see if we could prevent that from happening by inhibiting those enzymes, right? And so that's what we're doing in the lab. Like, does inhibition of these enzymes protect the chondrocyte from death when they're exposed to a nasty environment that looks like what's happening in the joint with arthritis? And so what we found here, and I'm going to go quickly to this, is that what we found is that when we use the cytokine that will induce the chondrocytes to cause apoptosis, we actually saw a decrease in apoptosis when we inhibited both enzymes. And what we found as well is that if you inhibit just one enzyme, just the COX enzyme, actually we could see a potentiation of death. And so that was kind of interesting, because if you inhibit both, you see a decrease in apoptosis, in cell death. But if you inhibit just the COX, you potentially can actually accelerate cell death in those chondrocytes, which is kind of concerning. Even though this is in vitro, we don't know for sure if it's happening in the joint. We're doing everything we can to try to minimize, mimic what's happening in the joint, but in a petri dish. But again, it's not a joint. So, but we definitely saw that in vitro. And so what we saw is that SEH inhibition protected the chondrocytes, and COX inhibition made the cell death worse. And so that was kind of interesting, but also a little bit concerning. And then what we also did here is that, inducing a cell death via other mechanisms, we saw that COX inhibition could actually, in this particular case here, had no effect on cell death when we induce apoptosis via this caspase-mediated mechanism. So depending on how the chondrocytes are undergoing cell death, these things may or may not play a role, right? And then another mechanism that is involved as well in cell death in the joint, cartilage cell, chondrocyte cell death in the joint. This one here was worst by COX inhibition. So in this case here, we're using bute, that's commonly used in horses. Some of you might use, or firocoxib, that's also used in horses. And there is a similar drug that's used in cats as well as dogs. And so we saw that these things actually could potentiate cell death, make the chondrocytes undergo death a little bit faster, whereas SEH inhibition did not. And so that was good. And what we found as well is that that potentiation that we saw from the COX inhibitors could be prevented from concurrent SEH inhibition. And so even though SEH inhibition by itself did not do anything, good or bad, for the joint, it tended to prevent the worsening that we saw in chondrocyte cell death caused by COX inhibition, caused by the bute or furocoxib. And so these things were interesting because it basically tells us that by modulating those two enzymes, we're able to prevent pain a little bit better. And we're also able to help the chondrocytes survive an inflammatory and nasty environment in the joint. So those are, good things. And here is just to show that we also saw that some of those end products here from the SEH, they themselves can cause cell death. And so we experimentally are proving that blocking SEH tends to prevent degradation of these good fatty acids, which then prevents, they can do their good stuff, and also prevents the production of these nasty end products that can actually make the chondrocytes worse, as well as they can cause pain, right? So proving that blocking both enzymes, especially SEH, can be very beneficial for the joint. And so the main finds here is that COX inhibition can make worse. SEH inhibition can be protective for the joint, and that's a good thing there. Now, we've done this experimentally, but then the question is like, can it work in the clinic, right? So that's where we have our patients. And this is the first case that I was able to use this SEH inhibitor. Again, these things are not available commercially yet. I was working with this like over 10 years ago, and we had a horse with laminitis that was in the barn. And for those of you that don't know what laminitis is, this is essentially inflammation of the nail bed, which is very painful, and especially in the horse, because the horse stands on the tip of its finger or its toe, it stands on its nail, essentially. And so if you imagine like an inflamed nail that you need to stand on it, it can be very painful. So this horse was going to be, nothing that we were giving it was helping. The horse was really in extreme pain. We were treating with everything we could, and it was just getting worse and worse and worse, which is actually a very common thing with laminitis, okay? A lot of horses, we unfortunately don't have good treatments for laminitis pain. And so this horse was going to be actually euthanized because the suffering was so great, and we're not able to treat its pain with what we had available. So therefore, we're going to resort to euthanasia, which is a very sad thing. And is a common thing as well. A lot of owners, unfortunately, that's their only option as well. So this horse had laminitis, not responding to any treatment, getting worse and worse, was going to be put down, euthanized. And I asked if I could, use some of these SEH inhibitors. And so I got the approvals from the ethical body of the university, and I used the inhibitor. And long story short, this was 12 years ago. The horse is still alive today. She recovered, and she did really well. So that was really encouraging for me to continue to study this, because I saw in a clinical case on a disease that's horrible, that we lose the battle for it many times, we were able to turn it around. And so that encouraged me to do further studies, and we were able to use 11 other horses on this particular study. These were all horses that were going to be euthanized. They were such in bad shape. That's when we got owner approval to be enrolled as animals in our clinical trial. And we saw that the majority of them had an improvement. Not all of them. Some of them, we were not able to turn them around, but the majority of them were able to get better. And so I think it's an amazing drug that we're still studying. It's unfortunately still not available clinically, but I think it has a lot of potential. And here, just want to share with you quickly some of the preliminary results that we have in arthritis in horses. So this was a horse that was arthritic in many different joints, was barely able to walk. You can see here, for those of you that have horses, you can see how lame she is, has a lot of joint pain, many different joints. And here she's being medicated with a COX inhibitor, and she cannot walk. You can ask her she cannot trot. You can ask her to trot, she cannot. It's just too painful. She can only walk, really. And here's another video after we treated her with a combination of a COX and SEH inhibitor. So you can judge for yourself about the difference. Okay, so here she's, a couple of days being treated with the two inhibitors, and I'd say she's a much better horse on this video. So really like amazing, like preliminary results that we have with these studies. There has been some studies in dogs as well that show also promising results with this soluble epoxide hydrolase inhibition. I think there is still need for bigger studies to be done, but there is still some promising results there. And then there is some studies now in people. We're able to publish that one study in the laminitic horse, and people have caught up on that, and now they're doing studies in humans on us, and it's being found that this soluble epoxide hydrolase seems to be involved in osteoarthritis of the knee in humans as well. So that's an interesting thing. The person behind this, as I mentioned here, is Professor Bruce Hammock, and he's at UC Davis, and he's now got a big, large grant from NIH to study these drugs for neuropathic pain. And so it's progressing in the human branch. And so hopefully, in a few more years, it will be available clinically for people. We haven't been very successful in getting enough money to bring this to fruition in the animal side, the veterinary side, but hopefully, we'll be able to make progress in the human side, and that will be great. And interestingly enough, a big reason why he got this grant was because of that first horse that we treated with laminitis. And so essentially it's like, a veterinary application that is now turning into a human application. A lot of times it's the other way around for this. And so we're, grateful for that, and hopefully this will come to fruition. We have done some preliminary studies in cats, and so this is my own cat that passed away, unfortunately, a couple of years ago at 18 years of age. She had arthritis as well, and we did a study on her. I didn't have a lot of things for to treat her arthritis at the time. Medications for cats for long term is not very available for us. And so we did a blinded study. I didn't know which doses of the inhibitor that she was getting. And we had different increasing doses. And what we saw is that as we increased the dose, she had a much better response for her lameness. And so essentially she was, feeling better and being more mobile from her OA. So that was very encouraging for this. And now we got some funding from Morris Animal Foundation to conduct a small clinical trial that we are doing here at the University of Minnesota. And we are currently enrolling cats with osteoarthritis. So the trial pays for everything for the cats. Like there is no cost for the owner. Unfortunately, you would need to bring your cat to us a couple times during the study, so then we can understand this. But we have this clinical trial, and here's a QR code that you can check. And we'd be very grateful if you're able to help us enroll, animals on this clinical trial, because we really need to know if this works, and if it does, which we think we do, that we can provide, another type of medication for cats with arthritis. So the take-home message from our talk today, very complex. I had to go fast through it, but the balance is that the right balance between omega-6 and omega-3 fatty acids can have both symptom and disease modification effects when we're talking about arthritis and so joint disease. We learned that COX inhibition, so inhibition of just one of the enzymes, with things like rimadyl in dogs, for example, or robenacoxib in cats, or meloxicam. So inhibition of that alone will help with mobility. So it does decrease pain, but it has the potential to worsen the joint health, right? As we saw, depending on how the cells are undergoing death, those chondrocytes, inhibiting COX only can actually accelerate that process and make the cells die a little bit faster, which is a problem, but it's really hard to recognize in our animals, because we know, or we believe, that osteoarthritis is a progressive disease. And so we're kind of expecting it to get worse over time anyway. So it's really hard to know if the medication that we're giving to help with the pain is also making the disease progress faster, because we already assume that it is a progressive disease. But we also learned today that inhibiting this other enzyme, this SCH, that was discovered again in insects, has the potential to improve both the symptoms, so improve the pain, as well as improve joint health. And we're, conducting these clinical trials now in cats, and there is clinical trials going on in humans as well. And we hope that in the next few years, we're going to have basically a better pain medication for both our pets as well as ourselves, right? And also we learned that's really important is that the diet is really critical, right? Again, we cannot make this omega-3 and omega-6 fatty acids. We need to ingest them from the diet. And so balancing that omega-3, omega-6 from the diet is really important. And then also that genetics matter, right? So the expression of these enzymes that we have is going to depend on our genes. And so each one of us are going to have, different expressions of those things. But again, diet's super important, right? And then hopefully in the future, we're going to have better medications to care for our pets as well as ourselves. So that's it, what I had to share. I think we have time for some questions, Will. And I'll leave this on the screen here if that's okay, so people can check the clinical trial that we have, and hopefully we ask your help for us to help our pets.
Thank you so much, Dr. Guedes, for the presentation. All right, so we'll start with some pre-submitted questions that came in earlier. One here is, does the research you cited show notable differences between how cats experience pain versus dogs?
Yeah, that's such a simple question. It's so challenging, right? And so it's really hard for us to know how the animals are experiencing pain, right? All we can say is that like, they're getting better mobility, for example, right? And by that, we think that they're having less pain. And so in terms of mobility, what we have seen is that the dog seems to have improved mobility when we modulate this particular enzyme. And our preliminary studies, and again, this is preliminary, right? As a researcher, I'm very skeptical. I want to make sure that what I'm saying is true, what I'm trying to prove is really true. So I'm always skeptical. So preliminary results in the cats, it seems very promising, and seems to be actually a little bit better than in the dog if I were to say that now. But again, the studies in cats are preliminary. We don't know how that's going to turn out. So it's hard to answer your question. Like, is that the same as dogs? We need to wait and see for the final results. It appears to be, but the final decision is not there yet.
We have a general question here next, not about any particular species. Can fats help tendons and ligaments heal?
Oh, that is such a wonderful, wonderful question. Based on the research that's being done in cells, some of which we did, based on the research that's been done in mice, and based on some of our own personal observations, it's very likely. And so again, these omega-3 fatty acids, they are capable of helping the tissues to heal, depending on, again, those metabolic enzymes, right? And so the answer to your question is yes, and then there is some further details there, right? That is important to take into consideration as well.
Awesome, thank you. Going back to horses for a moment, you shared an example of a horse in a clinical trial. How can a horse owner prevent joint problems for horses? Is there anything you can share about joint problem prevention?
Oh my gosh. That is another huge, huge question, right? Simple question, but huge. And so I think some of the same things that we talked about, right? So having your horse in a good, well-balanced diet, right? If you were able to have some more, omega-3 on that diet, perhaps that would be helpful. We didn't talk about here, but like also body weight and physical ability, right? So the support for that joint, if that joint, the muscles on the leg are weak and you have a large body, right? So you're perhaps overweight, the horse is overweight, that's going to put more stress on that joint as well. So controlling for those things is going to be important. And that means also good, training regimen, right? Exercise. So then the animal's in good physical shape. So there is there is no one magic bullet, right? Like, oh, this one thing will prevent your horse from having issues in the joint. That does not exist, right? So it's a combination of different things that involves, again, good diet, exercise, weight management, and then like well-balanced exercise as well. So I think those are all part of the holistic approach in helping not just the joint but the entire animal, right?
That
Yeah.
makes sense. Thank
And
you.
I guess working with your veterinarian, individuals that have, sports medicine specialty, they can help a lot with those things. And so I encourage you to, basically talk to your vet and seek guidance from that.
Awesome. Thank you. We have a question here again about diet. This person asks, I've heard pets should be on a low-fat diet if they have digestive issues. Does a low-fat diet mean incomplete nutrition? Is it
Oh my gosh.
having less of specific kinds of fat?
Oh my gosh, such a good question. Thank you for asking that. And, as we saw in the stock, not all fats are the same, right? And so clearly, we as humans, me included, we tend to generalize. We like to simplify things, right? Which, that's for good reason. Life is a little easier sometimes if we do that. But when it comes down to fat, not all fats are the same. And so definitely we want to minimize those saturated fats, those that go to uh, accumulation and then we use for energy. Those saturated fats also clog our arteries. Those are pretty nasty for the arteries too. And so definitely you want to minimize those, right? And so we want to minimize those fats for sure. You also want to minimize those mono unsaturated fats because those also go for fat accumulation, and it's not good. And then when it comes down to the polyunsaturated, you want to have a little bit more omega-3s. And so, yes, definitely you want to probably reduce the total amount of fat in your diet, in the cat's diet, generally speaking. But they need some fat, right? And they probably need a little bit more of the omega-3 fatty acids there. Those can be helpful. And so I think that is the answer, to this question is that you definitely want to be careful about the type of fat that you have in the diet. You definitely don't want to eliminate the essential fatty acids, right, from the diet, because again, the animals cannot make those. We cannot make them. So they need to have some of those essential fatty acids there in the diet for sure. And then if you can, tilt the balance a little bit towards the omega-3s, that's going to be even better for the cat.
That's great. Thank you.
Yep.
Next, we have a question about medications. This person asks about an obese adult cat taking Solensia to help with joint pain. And they're just wondering if you could share some information about medication options for joint pain.
Oh, yes. Oh, I'm glad that you asked this question. So now is the newest medication that we have on the market for cats is Solensia, right? So Solensia is an antibody, actually. It's a biological, right? It's not a chemical, it's a biological. So it's an antibody, it's a monoclonal antibody, which means that they all look the same. And this antibody is targeted to a chemical called nerve growth factor. And this nerve growth factor is a little chemical that's produced during inflammation. So a joint that's arthritic has more production of that. And it tends to sensitize or irritate the nerve endings in the joint and also the nerve pathways that innervate the joint. And so when you have a lot of this NGF, the nerve growth factor, pain is worse, right? And so by using a monoclonal antibody that binds to these things, the monoclonal antibody goes in there and just attached to this NGF and prevents it from working. Therefore, the nerves will not be seeing as much NGF, and the nerves are going to start, calming down and then going back to normal and becoming less sensitive, and therefore the pain gets better. And so that's how it works, okay? So the monoclonal antibody is just kind of like quenching, right? Those NGFs that are there. And so the animals feel better for that. And one good thing about it is that it does not require medicating the animals every day, which is the case for lots of other medications, right? Sometimes you need to medicate several times a day. And hey, I'm a cat owner. It's not that easy to medicate cats many times orally, right? And so once a month, for example, is much better as an injection for Solensia. So that's much better. And there has been, clinical trials, some studies showing that some cats can respond really well to that. It is a new medication, even though they've done good studies to show that it is effective. Now that we're using clinically in thousands and thousands of cats, we'll know a little bit more in the coming, months and years for that. One concern that I have with any biological is that our bodies and the animals' bodies will start recognizing that protein as a foreign thing, right? And so over time, it's possible that we or the cat is going to start developing antibodies against those antibodies. And so over time, it is possible that this won't work anymore. But, I can't say that for sure now. It's just a concern and something that I'll be watching for, but it might be helpful. Now, you mentioned about this cat being an obese cat, right? So one of the things that we didn't talk about here is that fat tissue that we have in our bodies, for example, is not just there as dead weight. It's actually a very active tissue. And one of the things that it does very well is produce inflammation. So when you have a lot of fat in the body, those fat cells, they are producing a lot of these inflammatory mediators. And so what happens is that the entire body becomes inflamed. And that can have obviously consequences for the joint, but also consequences for the muscles, for the GI tract, for everything, right? Because the entire body is more inflamed. And so it's really important to try to work on reducing that overall body fat, right? Because that, generally speaking, is a very pro-inflammatory tissue that it is not helpful. And so it's really important for that. And then the other thing too is that, in terms of the joints, if you have more weight on those joints, then that also can also help with, increasing the instability of the joint, essentially making it worse. So there's lots of reasons why, ideally we want to minimize, decrease body weight, increasing muscle mass as much as possible to try to get the body in better shape that way too.
Thanks so much for that.
Yeah.
Looks like we have time for one more question, and this is about an aging after an injury. This person asks about a cat with a leg joint that was hurt when the cat was a kitten and is now giving problems as the cat ages. So maybe it's a bigger question about aging as well.
Yeah, well, such a good question too, and that happens to a lot of us too, right? I mean, when we are young, as humans, we engage in physical activities that a lot of times result in joint problems. Me from Brazil playing soccer, I have both knees now; they're bad. Unfortunately, at the time I didn't think about that, but with our pets, kind of the same thing happens, and same thing the question about the horse and joint pain, right? But in any case, in this case, it seems like it was a trauma, right? Accidental, hopefully, and that now we're dealing with this. And as we age, our ability to repair anything really, it decreases, right? It's just a normal process of aging. And so definitely some things that maybe was not a problem up until a certain point, it starts becoming a problem because we're no longer able to kind of keep the repair up, right? And so what can we do now? Obviously, the diet is really important. We're talking about fats here. And so if we're able to kind of look into the diet composition and see if you can, decrease those, bad fats, let's call them bad fats, and increasing the good fats like the omega-3s, for example, that would be a good place to start. You're kind of helping the body in that sense, right? Physical therapy, that's possible as well. There is, different places here in the Twin Cities that offer those kind of things. And there is different modalities from, like just physical therapy with like massage and range of motion to other techniques like laser, like low-level lasers. And there's many others there too that can be helpful. And so I think, in this case, since there was trauma, that the tissues are probably not, healthy, if you will, that I think working on physical therapy can be very helpful. And then, many times combining, the diet as well as medication to help in that sense too, it can be the way to do it. So basically, like you need like a more holistic approach, right? Looking at the diet, the physical, as well as potentially medications to help with all of that too.